How many times do you really look at the nutrition label when you are grocery shopping? Well, Dr. Kohli is here this morning to talk to us about why that's important. How are you, Dr. Kohli?
Hi, how are you, Claudia?
I'm doing great. I do it sometimes, not always. But what are the key components here of a nutrition label, and should we be looking at them like all the time?
Yes, you should. And so I want you to really start working this into your grocery shopping routine, because the nutrition label tells us exactly what we're putting inside our body. So I want to go through how we should read it. So I start at the top where it tells you about the, the serving size. That's really important, because sometimes you look at just the bottom part of the label, you're like, oh, this looks pretty healthy, and then you see the serving size is tiny, and actually within that can or that bottle, there's a lot of servings.
A lot of servings.
Yeah.
Okay.
So that tells you how much food there is. Then there's the calories, which tells you basically how much energy you get from that particular food.
Okay.
Then you know all those percentages on there that talk about percent daily value.
Yes.
So that looks at a 2,000 calorie diet, assumes the average person's eating about 2,000 calories. Now, most of us eat more than that, but it tells you basically what percentage of nutrients you should get. And this is where you really want to try to maximize the healthy nutrients and minimize the unhealthy nutrients. Keep the percentages of the bad things low and the good things high.
Okay.
Does that make sense?
It does make sense, but I don't think I do that, at least not for everything that I put in that cart.
Right.
Now, what's considered a high or low percentage here?
So I like to keep in my head this thing called the 5-20 rule.
Okay.
So the bad things you want to keep below 5%. I'm talking about saturated fat, trans fat, cholesterol, sodium, sugars, not all sugars, but the refined sugars. Yeah, because you want fiber, but you don't want the refined sugars that are in there. So keep those below 5%. And then the healthy components, which is the iron, the potassium, the vitamins, the good nutrients, you want to really keep those above 20. So if you try to pick foods that have less than 5 of the bad things and more than 20 of the good things, that will sort of keep you at a good place.
Okay, see, I like the 5-20 rule, something we should all keep in mind. Okay, you said a little while ago that the average adult eats 2,000 calories. How do we know how many calories we should eat every day? Like, how do we base that?
Yeah, so it's a really specific calculation based on your gender, based on your age, and based on how sedentary you are. Now, we calculate all these nutrition labels based on a 2,000 calorie diet, but the truth of the matter is many of us eat more than we should be eating, and hence why we gain weight. And as we get older, our metabolism actually slows down. So we should be cutting our caloric intake by about 10% for each decade of our life.
Okay.
But what do? We keep eating the same thing. So what I like to tell my patients to do, in fact, I did this for myself, is to calculate my basal metabolic rate. That's based on my age, my gender, and my weight, my height. And that's a calculator that the Mayo Clinic has. So you type in all of those numbers, and then you calculate your total energy expenditure. So that's like how sedentary you are. I gave myself a sedentary score because I haven't been great about exercising. But if you're one of those people that's exercising every day, you expend a few more calories, and that tells you exactly how many calories you should be eating to maintain your weight. Now, if you're trying to lose weight, you cut it down by about 5%. If you're trying to gain weight, you increase it by 5%. But it's a really nice mathematical way for us to stay on track with our caloric intake, so that we're not just eating as we're getting older, and we need to eat fewer calories.
Yeah, we need to keep track of this. And what a good resource to have as well, where you can keep track of that. Well, what would your advice be for people when they are grocery shopping to make those healthier choices?
So the first thing I always say, and I try to do this myself, do not go to the grocery store when you're hungry.
Oh my gosh.
Then you
that
make
is so
bad
true.
food choices, right? You make a list so that you're not just, it's not like shopping for clothes. You're not just browsing, because then you'll end up picking up things that you don't want to pick up.
Yep.
Right? When you're making a choice between two different things, you pick them up and you flip them over and you look at the labels and you pick the healthier choice. So you're picking a jar of spaghetti sauce. You look at the sodium, you look at the fat, you look at the cholesterol, you look at the calories, and you make that healthier choice. And then this one was a little tricky, but I realized most grocery stores, actually, you shop the perimeter of the grocery store, because that's where the healthy foods are. That's where, the dairy and the whole foods, the fruits, the vegetables. In fact, in the middle, where there's no refrigerator or anything like that, that's where you have your processed or your boxed food. So you want to try to avoid the middle and sort of stay around the rim of the outside of the grocery store.
I've never thought about that, but I'm like picturing my grocery store and I'm going, yes, that is so true. Dr. Kohli, thank you so much. Great advice this morning.
Thank you, Claudia.
All right, everyone, do not shop hungry. I will firsthand tell you that is true. You'll want to buy everything. Make sure to email us your questions for Dr. Kohli. Just send your message to MyCOCO at 9news.com and put Kohli in that subject line.